So where were we?
We were talking about hair loss and how much hair loss is contribute, how much of hair loss I've seen in my dermatology practice, how many women and men are coming for hair loss. And I think stress has been a huge factor um,
Mm,
for contributing to this epidemic that we are seeing in dermatology.
I see. Is there any, also have to do with aging?
So, 95%
So,
of all the,
and also we are focusing on women in
yeah,
this field. Yeah.
correct. Yeah. So yes, absolutely, age is a contributing factor. 50% of 40% of women over the age of 50 will experience menopausal or postmenopausal hair loss. You can also see hair loss during pregnancy. You can see it during when they are breastfeeding. The changes, the reproductive changes in their lives, premenopause, menopause. Of course, in younger women, you can see hair loss or hair shedding if they diet, if they lose a lot of weight, pregnancy, surgery, emotional trauma, psychological trauma. All of these are these factors, and of course, nutritional factors like low iron, low ferritin, low thyroid can all contribute to hair loss. And what often happens is that women come to me because their hair is shedding, and what they start doing is they stop washing their hair because they're so concerned that if they wash their hair, it's going to fall. But the exact opposite. So what happens is that if they don't wash their hair, they treat the hair very gingerly, then they get dandruff or seborrhea, and that can perpetuate the hair loss, can make the hair loss even more because dandruff can cause hair loss. So often it's important to let them know that yes, you are experiencing the hair loss, but not washing your hair is going to make the problem even worse. So there are many, many factors. So all the factors that I've described to you, including genetic factors, stress, malnutrition, anxiety, medication. There are lots of medications that can cause hair loss. They all cause what is known as non-scarring hair loss. That's an entity that is manageable and can be controlled and treated. But then you also have the scarring hair loss, which is a completely different entity altogether, and that's treated very differently.
What about like um what about does it also have to do with your eating? So is there any specific kind of food that would and uh that would worsen the problem, or even just like cure the problem?
Yeah, I don't know of any specific eating foods that can cause hair loss, but if you diet and do restrictive dieting, that can cause hair loss because that can cause nutritional deficiencies, right? It can cause iron deficiency anemias, and it can cause protein deficiency. So, that's why hair loss is very common if you go on a starvation diet or a restrictive diet, and weight loss can cause hair loss by default, but not because of a particular food, but actually lack of consuming that food that causes hair loss. So it's really important to pay attention to all the dietary things that are causing the hair loss, and make sure that you're using good adequate nutrition, because it's very important.
I see. And also in Will Smith's wife case, so she has actually um had a disease like that caused her hair loss. I think like it is called alo alo Is it?
Alopecia areata.
Yeah. I'm sorry. I'm not fully familiar with the term. It's yeah. It's called alopecia.
Correct.
Yeah. So that is like kind of like different from um the the normal form of hair loss, right?
Correct. So alopecia is a treatable condition, right? So if you divide the whole uh, hair loss into scarring hair loss and non-scarring hair loss, alopecia falls in the non-scarring hair loss. So it can start as a small patch. It can look like a little coin on your scalp. You can see it sometimes on the eyebrows. You can see it in the underarms. People start, or in men in the beard area, the chin. You can get patches of bald patches of hair loss, and that's alopecia. It's called alopecia areata, which is an autoimmune condition. And so, what I mean by that is your hair, there are antibodies that are formed, auto antibodies that basically destroy the hair follicles, your own hair follicles. And so, you get patches of hair loss. So, you can get one patch, two patch, 10 patches. And if the condition progresses, you can actually get what is known as alopecia totalis. So the whole scalp loses hair. And then the other term is alopecia universalis, where everywhere there is hair loss. So eyebrows, axilla, pubic area, all of that can happen. So it's a very difficult condition because the psychological impact of having alopecia is huge. So I think we all need to have, and these women and men, they struggle with it, because it's such an expression of health and vitality and youthfulness that if they don't have their hair, we take pride and joy in our hair, especially women. So yeah, so I think having compassion and understanding where they're coming from is really, really important.
Uh, so is there any treatment for the alopecia alopecia disease at
Yes,
this point?
yes, there is. So if you have, the good thing about alopecia areata is that the the course is a bit unpredictable. So you can spontaneous regrowth can happen. So you can have a patch that was noticed suddenly by yourself or your hairdresser or your husband, and then in a few weeks to a few months, it just regrows without any treatment. So regrowth, spontaneous regrowth is possible and does occur, and it happens without any medications. Sometimes if you have the patch and it persists, then we can give a topical corticosteroid, like a strong steroid, to stimulate the hair growth. But often the topical steroid doesn't work as well as the injectable steroid. So basically, it's called Kenalog, and I basically inject the scalp, the bald patch, with a steroid right underneath the skin, and that stimulates the hair follicles because it's an anti-inflammatory, and because alopecia is an autoimmune condition, steroid is an autoimmune immunosuppressant. So it's anti-inflammatory, immunosuppressant, and it stimulates the hair follicles. So typically we do sessions every 6 to 8 weeks, and within a couple of sessions, the patch regrows.
Oh,
So
yeah,
so
please.
that's good. There are also there has been a really remarkable development in science now for hair loss, and there are many new drugs that are coming on the market, and they're called biologics, and they have completely changed the way we are going to be. Hopefully, they will be out in the next year or so. They are under clinical trial and will be approved by Health Canada, hopefully by the end of this year or early next year. And they have completely will revolutionize the way we treat alopecia, which will be so amazing. And so these drugs are called biologics. They're also known as JAK inhibitors, JAK inhibitors, JAK inhibitors. So they're we're very excited about that and looking forward to having them in our armamentarium.
What about like, is there any like potential prevention for both normal hair loss and also alopecia?
A differentiation,
Oh, some kind of like prevention. Is there any?
prevention.
Yeah.
No, alopecia areata typically, because it's an autoimmune condition, often people who get alopecia areata, and I'm seeing a lot of that post-COVID, there's often a stressful trigger. Some stressful event happens that triggers, that sets the immune system, immune function to start, getting these, making these bald patches. So your immune system is activated, and I think stress is an important precursor for that event to start. But once you have alopecia areata, uh, you can have one patch and never have it again, or you can have patches that come frequently every week, every month, or it could be years can go by before you have another patch. So it's very different, and it appears differently in different people.
Oh, but what about like for the normal hair loss?
Yeah,
Is
so normal hair loss, it's very different because with alopecia, you actually see a bald patch, and the area around it is completely bald. There's no hair growing there. Whereas normal hair loss, you see, is generalized. You lose hair all over. But typically, you have about, hair grows at the rate of what, half an inch a month. And you typically have, we all have about 100,000 to 150,000 hair follicles on our scalp. And 90% of our hair, so 100,000, let's say assume 100,000 hair on our on the scalp are in the growing phase. That phase is called the anagen phase. So 90% of hair are growing, and 10% of them are in the falling phase, also called the telogen phase or the resting phase. So if you have 100,000 hair follicles, it's normal to lose 100 hair a day. That's normal because that's the normal hair cycle. 10% are you're going to at any given time. But when you lose more than 100 hairs a day, if you're losing 200, 300 hairs a day, definitely that's going to be a problem. So, and that is called telogen effluvium. It's not alopecia areata. It's called telogen effluvium. It's a completely different phenomena, and often induced by stress and anxiety, nutrition, pregnancy, aging, menopause, all sorts of things.
and also like I'm just wondering, so how does COVID the pandemic impact this problem?
I think people have been so distressed and so anxious. Our lives have been completely uprooted, right? It has been a catastrophic event in our lives, and everything has been disrupted. All our normal structures, the way we saw life, the way we lived our lives, social, economic, family structures, everything has been uprooted. There's depression is high, anxiety is gone through the roof. So everything has been disrupted in a way that we would never have imagined, and so that's been very stressful for a lot of people. People's jobs have been at stake. They've lost job financially, they haven't done well. It's a huge thing for everybody, and so the stress of that could be a trigger for either telogen effluvium or alopecia areata.